Welcome to our presentation. We are Team A and I'm Mama Tejiki. Okay, guys, now you all of know about our topic we are talking today. It's the health service in Sri Lanka and its current status. Okay, guys, this health service is done not only Sri Lanka but also other countries now. Then I think you all know about it. You can see this side. Those are our topics under the main topic we are talking today. And our first topic is history of health services in Sri Lanka. Do you know about the history of health services in Sri Lanka? Okay, actually we can divide it three parts of this history of health services in Sri Lanka. First one is how did it start, traditional health services, and last one is Western health services. Okay, before discussing my part, I will say a few words. If you can't be a king, be a doctor. Now you all have a problem what I said and why I said about it. Don't worry about it. I will explain as moment. Okay, let's see this system. You can see this. Actually, I'm not going to read it, and you see this. This has noted this system is very oldest health service in the Sri Lanka, and this system is oldest than about 3,000 of years in the island. And so I think you all have read about it. Then let's see about this traditional health services. Actually, speaking, this Sri Lanka its own inherent of traditional medicine, which is called Sinhala Vedakama. I think you all know about it because you all of Sri Lankan people know. Then I think about it. So I found out saying about this system. This system has been practiced for thousands of years in the island nation. On the other hand, this Ayurvedic traditional system is mixture of the Sinhala traditional, and this Siddha system is the traditional health service in India, and the Unani system is the traditional health service in Arabs. So and most importantly, the local treatments, which is the local medicine of Sri Lanka. Furthermore, you know about Sarad Sangrahaya because this Sarad Sangrahaya is the most popular book in Sri Lanka, and this book was written by Dr. King Buddhadasa. I think you know about him because he's very popular king in Sri Lanka. So this literature book written by Dr. King Buddhadasa is still used even today. Then we can confirm there was an organized health service in Sri Lanka, and for the first time in the world, a dedicated hospital for the patient founded in Sri Lanka. And also there are ruins of buildings believed to be the first hospital on top of Mihintala mountain. But although Mihintala is said to be the first hospital in Sri Lanka, but it's still a belief among people. And okay, now you can understand what I said about this traditional health services. So guys, when I start my presentation, when I start my part, I will say some few words about it. It's if you can't be a king, be a doctor. Actually, now you all of can understand what I said and why I said about it. Actually, this health service is most important than becoming a king. So it's time to end my part, and now you can know about the health service in Sri Lanka and its current status from our other team members. Now I invite Adish to continue our presentation.
All of you, I'm Adish. I'm from Team A. Today I'm going to present about Western health service in Sri Lanka. Sri Lankan has oldest instruction dedicated to treating any patient in the world, from Lining Home and Ayurveda Hospital built by King Pandukabe. The Sri Lankan first hospital in Sri Lanka, the Portuguese introduced Western medicine to Sri Lanka in 16th century and opened the first hospital in Mena. First hospital in Sri Lanka was in Tamilkins in Jaffna. Nan Margottu Siddhi Hospital is the first hospital in Sri Lanka. Nan Margottu Siddhi Hospital is the first hospital in Sri Lanka where patient can stay for treatment. The Dutch Hospital in Colombo Fort was built in 1669. The Dutch Hospital in Colombo, the Dutch Hospital in Gold remain the oldest hospital can be called the hospital product practiced Western medicine. Dr. John Iskut is the first missionary to introduce Western medicine to South Asia. Dr. John Iskut came to northern Sri Lanka in December 1819 and following years founded a dispensary in Panditippu, a small village in Jaffna. Following Dr. John Iskut, Samuel Fish Green, who came to Jaffna in 1847, is credited with transformation of medical education. Initially founded a dispensary by Samuel Fish Green. My part is N. Our next part will be presented by Kavisha.
Good evening all of you. I'm Kavisha. Our next topic is free healthcare in Sri Lanka and its social impact. Now I hope to present about free healthcare in Sri Lanka. Okay, you know there are a lot of countries in the world, but only a few countries has a free healthcare system. Actually, as Sri Lankan citizens, we are very lucky because our country has also a free healthcare system. Okay, now let's see that what this free healthcare is. I think you all have heard something called free healthcare and universal healthcare. If we simply consider, free healthcare means all citizens receive healthcare without having to pay for all services, and universal healthcare means there is a healthcare system that provides coverage to a high percentage of all citizens. Okay, this free healthcare was started by in Sri Lanka in 1951, and it was started by Sri Lankan government. Okay, now I'm not going to talk about history again because you all have know about that, no? Okay, look at this chart. You can see from this chart only 4% of gross national product of Sri Lanka is used for health services, and only 5% of that is used for preventive health services. Actually speaking, as a country, more priority should be given to preventive health services, but in Sri Lanka, only 5% of healthcare services is used for preventive health services. Anyway, let's see that how a government can maintain this free healthcare system. You may think that this is completely free of charge service, but in really, government collects the money for all services from people through indirect and direct taxes. Okay. Now let's talk about curative and preventive health services. In curative health services, mainly focus on curing diseases by using medications, and in preventive health services, reduce the risk of getting sick by various treatment methods. Okay, you can see from this chart the government hospitals are how government hospitals are classified. Okay, I am going to talk with you two types of about two types of treatments. We can get both residential and outpatient treatments from all government hospitals. And there is a special qualified hospital crew, and we can get best treatments from them. Okay, look at these pictures. Do you know there is a best emergency service in Sri Lanka? You can see from this chart, from these images, how efficient these services are. Okay, we have wide range of curative health services like these available from all hospitals, all government hospitals. And let's talk about preventive health services. You all know we all get immunization vaccines from our birth, and health screening programs, maternal and clinic programs, and disease control programs are conducted by government. Okay, so finally look at this small video clip, and then you can understand how is overall Sri Lankan healthcare system.
The healthcare system in Sri Lanka is a mixture of public and private healthcare services. The Ministry of Health is responsible for providing healthcare services to the general public, while the private sector provides additional healthcare services to those who can afford them. The healthcare system in Sri Lanka is considered to be one of the best in South Asia, with a strong focus on preventative healthcare. The public healthcare system in Sri Lanka consists of a network of hospitals, health centers, and clinics. These facilities are primarily funded by the government and provide free or low-cost healthcare services to the general public. The government also provides free vaccinations, maternal and child healthcare services, and other preventive healthcare services. The private healthcare sector in Sri Lanka includes private hospitals, clinics, and other healthcare providers. Private healthcare services are generally more expensive than public healthcare services, but they offer higher quality and more personalized care. In recent years, Sri Lanka has made significant progress in improving its healthcare system. The country has implemented a number of programs to reduce the incidence of communicable diseases, such as malaria and tuberculosis, and to promote healthy lifestyles. Sri Lanka has also made significant investments in medical education and research, which has helped to improve the quality of healthcare services in the country. Overall, the healthcare system in Sri Lanka is considered to be a model for other developing countries. However, there are still challenges that need to be addressed, including improving access to healthcare services in rural areas and addressing the growing burden of non-communicable diseases such as diabetes and cardiovascular disease.
Okay, my part is over. Now I invite to Arosha to continue our presentation. Thank you.
I am Arosha Hesan from Team A. I think that you know what the free healthcare is. Certainly, free healthcare has several social impacts of free healthcare. Okay, today I am going to present about the social impacts of free healthcare. Actually speaking, there are many social impacts of free healthcare, and there are both good and bad sides. First of all, let's talk about the good social impacts of free healthcare. You know, Sri Lanka is a poor country than other countries, but there are both rich and poor peoples. Rich and poor people. However, everyone receives same free healthcare service without social inequality, and as a result of Sri Lankan healthcare, Sri Lanka is leading in terms of healthcare system reduction, such as the maternal deaths, child mortality, and high life expectancy. Do you remember? Can you remember? We had to face for the Corona period, and also we were in great trouble, and we were able to eliminate the COVID epidemic from our country because of we having a good free healthcare system. And today time students are also learning about free healthcare for their education, and free healthcare system allows children to go to school without a fear. And let's talk about the bad social impacts of free healthcare. Actually, health sectors are decreasing rapidly. Health sectors are decreasing rapidly in Sri Lanka because the doctors, nurses, attendants, and medicines are running low. And in addition to corruption and mismanagement have also affected the free healthcare in Sri Lanka, such as waste and efficiency, and the erosion of the public trust. And finally, free healthcare in Sri Lanka may attract medical tourists from other countries, which may interest medical system and divert resources away from patients. Okay, my part is over. I invite to Yasinta to continue our presentation.
I think you have idea about the topic what we are talking about today. So anyway, my topic is doctors living the country with current economic situations. But I only do the doctors in the country with current economic situations. Other part will be presented by another participants. And then first of all, we want to know why doctors live from Sri Lanka. No? Then let's see about it. Then there are several reasons on this slides too, and let's discuss those one by one. Okay, first one is government not paying good salary to doctors. Actually speaking, if someone want to be a doctor, then it has to waste at least 20 years. No, then they don't expect to work for low salary. Actually speaking, we don't also expect a low salary. No? Then it is also a reason. And let's see another one. Second one, I think it is a special one because I could listen it these days on news, because it is the main news of these days. No? However, it is government not providing necessary facilities to doctors, but the doctors who are in cities like Colombo, then they have necessary facilities, but the doctors who are in rural areas, they don't have facilities. No? For example, the children of doctors always try to go to international schools. Then there are no any international school in rural areas. Then they don't like to go to the rural areas due to the lack of educational facilities. No, I think it's also special reasons for this, and there are so many necessary facilities, but I am not going to explain it here. And third one, I see this as a reason, but I couldn't find any details about it on internet. It is doctors leave the country because of current inflation in Sri Lanka, but I couldn't find any details. I said it no. And last one, I see this as a very special one because I don't know that it is true, but I guess It is these days there are so many patients die because drugs poison. No? Then sometimes doctors can think it can make a bad mark for their responsibility. No? Then they have a big responsibility. Then some patients die. Then they can affect to doctors. Then they try to go to the Europe countries because of these reasons. And I say Sri Lanka has bad drugs poison. Then these days you know about it, no, because you could listen it on news. Then you can read this and get idea about it. I'm not going to read it and explain. And these are the reasons why doctors leave from Sri Lanka. I think you could get idea about it. And I think this is time to end my part, and I will invite Tenli to present our presentation. Thank you.
Okay, good evening everyone, and now you know about many informations about health service in Sri Lanka and current status. So now I'm going to talk with you about impacts of doctors living in other countries from Sri Lanka. Okay, now do you know why doctors leave another countries from Sri Lanka? Okay, let's see impacts of doctors are leaving other countries from Sri Lanka. Under the impacts of doctors living in other countries from Sri Lanka, I talk with you about 4 impacts. Among them, first one is patient discomfort. Patient discomfort is the main impact of doctors are leaving other countries from Sri Lanka. And I talk with you about other impacts under the patient discomfort. Okay, let's talk about patient discomfort. You know what is the patient discomfort? In the past few days, do you know how the people who are living in Sri Lanka discomfort? Okay. You can see from this image the people who are living in Sri Lanka are waiting in drug quizzes. Not only drug quizzes but also like things, milk powder, LP gas. In the past few days, Sri Lanka, the people who are living in Sri Lanka had to face any things. Okay, and you can see from the second picture there is a girl. Here is the girl who dead because of the bad drugs. I'm not going to explain it because it is not my topic. Okay, now I'm going to show you a short video about medicine series in Sri Lanka. This is an international news. Okay, let's see.
The crisis-hit island nation of Sri Lanka has been facing many shortages since a year now, and its essential drugs and medicine scarcity has further intensified over the past few weeks.
I told you the people who are living in Sri Lanka had to face drug quizzes in the past period.
There exists a shortage of around 90 medications at the moment. Despite the shortage, many still visit state hospitals to obtain medicines and for free routine checkups.
We came in the morning to get medicine for my mother, and we just got a part of the prescription. We were told to take 2 medications from outside and a few checkups to be done privately too, because the government hospital does not have them. We are quite worried because with the current economic strains, it's difficult to get these tests and medicines privately.
Sri Lanka's inflation has been hitting record levels for consecutive months now. Coupled with a shortage in medicines, those already living under economic constraints have been pushed to an extreme to access basic medical services. This is Kumari. She visited the Colombo South Teaching Hospital.
Okay, I think it is enough for now. Now let's talk about our other impact. Our second impact is there is a shortage of doctors in Sri Lanka. You know about it. There are many doctors have left from Sri Lanka due to the current economic situation. Okay, and according to the Ministry of Health, now there are about 20,000 of doctors are working in Sri Lanka. As I think among them, many doctors have left from Sri Lanka. Okay. There are many disadvantages of doctors live in other countries. You know why doctors leave other countries from Sri Lanka, so I'm not going to remind it again. So let's go to our third impact. Our third impact is declining health status in Sri Lanka. Okay, you know, in the past years, Sri Lanka has traditional health service. Traditional health service is our traditional health service is Hela Vedakam. You know about it because Amaya said it, and I'm not going to remind it. Okay, in the past years, the people who are living in other countries also come to Sri Lanka to get treats for them. But now it is not so. They know our country is poor country, and they know now Sri Lanka's current economic situation is not good. Okay, so if we find a traditional health center in Sri Lanka now, we can find only a handful of traditional centers in Sri Lanka. Okay, our third impact and last impact, postponement of surgeries due to lack of specialist doctors. Okay, now you know, the people who are living in Sri Lanka have to go abroad to do their surgeries. Not only surgeries but also like and other things. Okay. Now Sri Lanka has faced shortage of specialist doctors because they go abroad due to the current economic situation. Now Sri Lanka has about 10 anesthesiologist doctors. Okay, I'm not going to describe about it now. This is okay. This is time to end of our presentation.